Hello, and thank you all for joining us today. My name is Mia Cifuentes, Research Assistant. Today we're going to talk about how what we eat affects our blood sugar, or glucose levels. Today we're going to talk about why does our body need sugar? What is diabetes? What are the ways we can manage our blood sugar levels? Our bodies use glucose as the fuel source that gives us energy. We get glucose by breaking down the sugar and carbohydrates we eat. Our body produces the hormone insulin to manage the glucose in our body, from helping it get to the cells for energy to ensuring it is stored in our body safely. Diabetes is when your body is chronically unable to process glucose. There are two types of diabetes. Type 1 diabetes is when the body cannot produce insulin. This is usually diagnosed in childhood. Type 2 diabetes is when the body's insulin doesn't work well, or your body can't get enough of it. This type of diabetes develops over time due to the lifestyle and genetics. There is no cure for diabetes at this time, but it can be managed with diet, exercise, and medication. Diabetes is closely linked to other conditions. Those with diabetes are at a higher risk for developing heart-related diseases like hypertension, stroke, heart attack, or chronic heart disease. Diabetes can also contribute to poor circulation and nerve damage in extremities, like the feet. Diabetes is linked to gum disease and can cause oral health complications. Diabetes can also cause vision loss through conditions like blood vessel damage, or diabetic retinopathy, and optic nerve damage, or glaucoma. It is important for those with diabetes to regularly monitor their blood sugar levels. There are two standard methods to do this. The first is with a glucose monitor, or stick test. It's called a stick test because it requires sticking yourself to get a drop of blood that is read by the monitor. This is an immediate reading for your current glucose level. There are certain numbers that are looked for when someone is fasting, hasn't eaten in 8 to 12 hours. The ideal fasting sugar level is 80 to 100 milligrams per deciliter. A reading of 100 to 125 milligrams per deciliter is considered diabetes. Anything over 125 milligrams per deciliter is considered diabetes. Again, these are the numbers if you are fasting. Blood sugar is higher after we eat. The other standard measure is the A1C blood test, which measures your average blood sugar level from the past 3 months. Anything under 5.7% is ideal. 5.7 to 6.4% is considered pre-diabetes. Someone is considered to have diabetes when their A1C is over 6.4%. We've said that checking your blood sugar regularly is an important part of your diabetic management. This includes getting an immediate reading several times a day using a glucose monitor. This means having to do a stick test multiple times a day, like before and after eating. However, there is now continuous glucose monitors, or CGMs, which are becoming more common. These are devices with a needle that you wear on your arm or stomach for up to 2 weeks, depending on the brand. The monitor gives immediate readings and continuously measuring your sugar, recording a reading every few minutes. Top brands are Dexcom and Freestyle Libre. The monitors are wireless, connected to your phone using an app, so you can check your readings regularly. The app also collects the data over time that can be shared with your healthcare provider. But just monitoring your blood sugar doesn't manage diabetes. We also have to be mindful of eating healthy. The first step of healthy eating is knowing what foods are healthy. Remember the 3 main groups: plants, protein, healthy fats. We can better manage our glucose levels by eating more. Plants, which include fruits, vegetables, and whole grains. Proteins, such as lean meats like poultry and fish, beans and tofu. And healthy fats like olive oil, nuts, and avocado. When managing your blood sugar, avoid foods and drinks that are high in sugar, high in sodium, high in saturated fat. Also, processed foods, since many of the good nutrients have been removed during preparation, but all the calories are left behind. Overall, healthy eating involves avoiding these foods regardless of whether you have a health condition. Remember, skipping meals is not healthy. It is important to eat at regular intervals, ideally 3 meals and 2 snacks a day. Skipping meals results in sugar crashes, which don't help in managing stable sugar levels. It's also important to stay hydrated. Drinking enough water helps with lowering the sugar concentration in the body. When trying to figure out what foods to eat, there are several things to keep in mind. When buying packaged foods, check food labels for their sugar content. Look out for added sugars. Choose options to have little to no added sugars. Reduce the amount of fruit juices and dried fruits since the sugars in these are more concentrated. Reduce the overall amount of carbs you eat, and increase the amount of vegetables you eat. Finally, swap out processed starches for more complex carbs that are high in fiber and low in sugar. Staying active is very important to managing glucose levels. Your body needs to burn more energy. This helps to lower your blood sugar. Staying active also helps you to reach and maintain a manageable weight. Both cardiovascular and strengthening activities are good. Other things that people may not realize is that exercise also helps with mental health, sleep hygiene, and energy levels. Medications are usually also included in diabetes management plans. There are several medication options. Oral options include metformin, a generic medication, and Jardiance. Another option is insulin injections, either through a syringe or insulin pump. Insulin pumps is a device that stays on for a period of time, like a CGM, that administers insulin as needed. Newer ones can link up to a CGM, administering insulin based on your immediate glucose levels. Ozempic and others like it are a newer class of medication that were developed for managing glucose. Which medications you use should be a discussion between you and your healthcare provider. Don't think that you are fighting alone in figuring out how to manage your blood sugar. Your healthcare team is there to help. Speak with them and ask questions so you fully understand your conditions. Work with your team to set treatment goals. You should be part of the planning and goal setting. Members of your healthcare team can include your primary care provider, a nutritionist, and endocrinologist. Today we talked about why glucose is important and what happens when the body can't effectively process it. To support our body, we have to find ways to manage our glucose levels. Tracking blood sugar, healthy eating, exercise, and medications are all ways to manage glucose levels. Remember that you're not alone in this. Work with your healthcare providers to create a management plan. Thank you everyone for your time today.